My name is Suleima Salgado, and I am currently the Chief Operations Officer for the Global Partnership for Telehealth, as well as the Director of Programs for the Southeastern Telehealth Resource Center. Today, I'd love to talk to you all a little bit about virtual care and how we leverage telehealth to increase access to care in rural and underserved communities. I'd like to start off by just talking a little bit about telehealth, and we all know that telehealth has expanded exponentially across the healthcare continuum and has a profound adaptability to diverse technologies, modalities, business models, specialties, disciplines, and various locations. We all know that during the COVID-19 pandemic, many clinicians and their patients were forced to explore and implement alternative innovation forms of healthcare and implement medical treatments in order to see their patients virtually, given that we were not able to be around each other due to social distancing. For many patients, telemedicine was really the only true link to healthcare. During today's chat, I really would love just to talk to you a little bit about the overview of the field of telehealth, how telehealth evolved, maybe some fundamental concepts of telehealth, the telehealth system, and how it works in healthcare settings, talk about a couple barriers and challenges that affect the implementation and the evolution of telehealth applications. But really, my goal is just to make you all become telehealth champions and/or to better understand how telehealth is being leveraged across the globe. It's important just to let you all know that I have no relevant financial interest or arrangements or affiliations with any organizations related to commercial products or services discussed in this program. Again, it's really intended to just be an informative conversation and really just educate you all on a little bit more around telehealth technology. I'll start off by letting you know that I am a part of the NCTRC, the National Telehealth Resource Center Consortium. It's a collaboration of 12 regional and 2 telehealth resource centers. We call ourselves TRCs. As federally funded programs, TRCs can assist with various things to help you all implement and start up telehealth programs. We help with policy and reimbursement. We help with business models and just getting started, education, equipment selection, practice guidelines, program development, one of my favorites, training, professional development, and much more. Personally, I am part of the Southeastern Telehealth Resource Center, as you can see highlighted there on the screen, in that teal green on the bottom right. We cover the states of Alabama, Florida, Georgia, South Carolina, and the U.S. territories of Puerto Rico and the U.S. Virgin Islands. This is our team. We call ourselves mighty, but tiny in comparison to many others. We are all of us are very robust and knowledgeable in telehealth technology, skills from IT to program development, as I mentioned before. We are most of us live in Georgia, some of us live in Florida, but we do work together every day to work with our stakeholders and implement telehealth programs. One of the really cool features that we have as a telehealth resource center is we have a mobile telehealth learning center. So after today's presentation, if you guys are ever thinking about how telehealth can be leveraged, if you have health fairs, different events, educational events, we would love to bring out our mobile telehealth learning center to you all and allow you all the opportunity to get some hands-on training on telehealth, see how we can connect back to different providers based on clinical needs, do demonstrations in some of your schools, again, and provide just that education and awareness about telehealth. So I'd like to start off with giving you a little bit of understanding around telehealth or virtual care. The terms are oftentimes used interchangeably, and I'm here today to tell you that yes, you can use these terms interchangeably. Telehealth, telemedicine, digital health. It's really important back in the days, we used to say you can only use telehealth for video to video. You could use telemedicine when implementing clinical services. But right now, telehealth or telemedicine, again, can be a term used interchangeably. According to the American Telemedicine Association, telehealth is defined as the use of medical information being exchanged from one site to another site via electronic communications to improve a patient's clinical health status. Today, telehealth trends are growing steadily, as we've said, in the market, and solidifying a place in the market as crucial care and a delivery service. Gone are the days of everyone thinking it was just an innovative tool or a new way of doing clinical services. Telehealth has really established itself as a standard model of care. Again, just to set the tone, there are various different types of terms used to describe telehealth, and I'd like to talk through a couple of them with you all today. So you have your virtual visits, which we like to call those live synchronous interactions and encounters between a patient and a healthcare provider of any type via video, phone, or live chat. As long as they are synchronous and live, they are considered virtual telehealth visits. The chat-based interactions, which I mentioned, is a little asynchronous, meaning if it's an online or a mobile app communicating to transmit a patient's health data, vital signs, or other data and diagnostic images. So sent, you wait, and then feedback comes back at a later time. There's not that live, just in real time interaction. One of those modalities, type of that, is remote patient monitoring, which many of you are familiar with and is really trending as well lately. And it's really supporting that ongoing monitoring of chronic disease management. And that could be done synchronous or asynchronous, depending on the patient's need. I have a smartwatch on right now, and that is able to generate a lot of feedback and data and send back to my medical provider. In addition, there's telehealth-enabled technology and modalities. And we really like to look at those enabled modalities as other services when we're looking at telehealth and virtual care solutions between clinician or provider to provider. It allows those consultations, that education, transmitting data, lessons learned, best practices. We like to put kind of our ECHO models, Project ECHO models, in that technology-enabled modalities, where it's that peer-to-peer review and education. It's really important to really understand the telehealth goals. There are so many goals and benefits for telehealth. And one of the biggest reasons that telehealth came about more than 20 plus years ago was to truly help us overcome that geographical barriers. We know that there are many rural, underserved communities that are very limited on resources and access. And leveraging technology to help meet those needs is truly the purpose of telehealth. We also know that by improved access and avoiding and limiting those geographical barriers, we can improve patient outcomes. And it also helps us with increasing adherence. We know that telehealth technology helps build and bridge that geographical boundary between patients and their doctors. It truly delivers care in faraway locations with a shortage of transportation options. Example of that, we have family members and loved ones that may live in South Georgia or may live in North Georgia and have to come into Metro Atlanta for an appointment. Many of us who live in Metro Atlanta don't always enjoy the issues that we face when dealing with transportation. Whether it's a 15-minute doctor appointment up the road, it could take us sometimes an hour to get there. Imagine living in South Georgia and being a parent of a kid who needs to see a pulmonologist once a month for medication adjustments and for his asthma. Having to drive 4.5 hours once a month, just imagine having to take off work, looking for transportation, the time it takes you to get there, if you have other children missing school, just to get to your appointment. The thought of leveraging telehealth and having it in your local community or available to you via phone and being able to connect back to that provider in real time, just think about the return on investment. It truly provides specialty practitioners that advantage of seeing patients in their home environments. And this can provide essential insight on different causes of death and health conditions. And it also really helps us monitor patient health remotely, providing us with vital intervention in emergency cases. But most importantly, we also learn so much more about people's overall health just based on the environments in which they live in. Please note that for me, telehealth is definitely not intended to replace your medical home. We never want to take business away from local communities, and we want to make sure that your resources are always available to you in your local community. The goal for telehealth through these programs is truly to increase access and to help meet the needs of those who don't have specialty service providers. While, of course, it could be very convenient for others, that is not our general and overall awareness and goal and purpose for telehealth technology. But it does help many of us who have resources available. Telehealth can look very different, and we always wonder what the technology looks like, but it seems like it's getting a lot more innovative and smaller and more concise. As you can see displayed on the screen, you can see different type of peripherals and solutions from the carts in the top right corner. Those are the ones we always joke around and say, that's kind of what telehealth started looking like. They were these big kind of robotic carts. They were very bulky, took a lot of space. And depending on the type of clinical service you're providing, you still need those big, robust carts for interactions and telehealth consultations. If you're in a hospital system, if you're in a healthcare system, if you're in a school, sometimes those carts, the bigger they are, the more they can do. You can see also there's like a small little skinny long cart to the right with an iPad on top. Some of those could be used for just general video to video interactions, and that is great as well, without the extra peripherals. Peripherals I'm referring to are items such as a horoscope with a general exam camera, a stethoscope, an otoscope, a dermscope, an ultrasound. Anything you need to be able to do a consultation and to see your patients can be added to almost any telehealth solution nowadays. Again, you have to keep in mind, are the patients coming to a site to be presented by a nurse or a staff member and then connected back to that provider in real time? Or are they connecting from their home back to a provider? Both cases, truly accessible and acceptable as telehealth, but it really determines based on the type of service that you're trying to provide. Telehealth can also just be something as simple as a trunk. And inside that trunk, you have small peripherals, video cameras, laptops, etc. Many of us use telehealth all the time just to call our loved ones. It's a form of video conferencing, whether you're using FaceTime, Team, Zoom, WebEx, Doxy.me. There's so many telehealth platforms that you can use across the board. Again, that is all considered a telehealth consultation. As long as you're talking back and forth on video to video, discussing your health, that's a telehealth consultation. The most important thing to remember is not that the COVID pandemic has ended, is that you have to make sure that any true telehealth consultation is on a platform that is HIPAA compliant. Let me just show you how cool some of these images are that we can capture from a telehealth consultation when having a telehealth presenter present a patient back to the physician. Yeah, pretty impressive, right? So what you see there are images of teeth. You can see an area of concern on the skin in the middle. The bottom, you can see inside someone's mouth with an image. And the far left, many of you are probably wondering what that image is. It's inside someone's ear. And I wonder if any of you can really tell what that little item is inside that ear. I'll tell you, we've seen many of things from Legos to chocolate chip cookies to jelly beans, all kinds of random stuff. But that you see right there, that's a good old South Georgia gnat. We had a patient come into the clinic complaining of ear concerns and saying he went out on a fishing trip with his buddies, came back, and for a couple days, his ear was just ringing. He didn't know what it was and what could have happened, but he finally wanted to go in and have someone take a look at it. When we looked inside the ear with a stethoscope, which I think is fascinating, using a stethoscope and letting someone see what you're looking at in real time via telehealth, we found a South Georgia gnat. And I'll pause by saying, this is a perfect lesson and opportunity, not only for adults to be able to see what's going on and what the physicians and nursing staff are looking at inside the ear, but for these children and for these parents and these patients. Imagine just sitting in your patient ed waiting room. How many of you have always wondered, well, what are they looking at in my ear? Is this just procedure? Do they pretend to look in my mouth, look in my ear and in my throat? What are they looking at? Well, just think, a telehealth consultation in real time, allowing you to see exactly what your provider is seeing, is a great opportunity for us to share and provide education. Imagine a kid in a school setting looking inside his ear and inside his mouth. We get so many oohs, ahs, but also allows us that opportunity to answer questions and have a true conversation. With that, I want to share a couple ideas and kind of concepts around how telehealth applications are really happening in different settings in which telehealth can occur. From behavioral health settings to emergency services, to home health, to school health, to primary and specialty care, maternal fetal medicine, high-risk OBs, of course, and so much more. Imagine being in a school and knowing how much many students lack that access to healthcare outside of their school walls. Leveraging telehealth extends the hands of those healthcare providers and those professionals to reach the children in the schools where they frequent the most. Just think about having to go to the clinic and how many kids get sent to the clinic with those nurses, and how many nurses have to call the parents, refer them back to their doctor's office to go in to have an appointment and be seen. How cool would it be if you had a telehealth technology or telehealth solution in your school setting and you had nursing staff and clinical staff that had the opportunity, resources, and time, importantly, to be able to connect back in real time when they have sick students to a local pediatrician in the community, probably where most of these kids attend anyway, and be able to have a consultation in real time during the school day, allowing for that care management, if medication is needed, if referral services are happening, to all be done. So when the kids get back home, they can just work with their parents to pick up any prescriptions as necessary and go on with their day. Now, let me say, Everyone quickly wonders, well, what about the parent? If this is happening in the school, how are the parents going to know? That's the benefit of telehealth. The parents can be part of these consultations as well from their homes, from their work, from their jobs. We can add them to consultations and allow that full comprehensive consultation to take place. If a grandparent or another loved one or a caregiver needs to be a part of those consultations, they can also join the consultation. Think about absenteeism, think about that reduction. How cool would it also be if the staff within the school system could also connect back to a provider? That would help with so many issues around lack of teachers and looking for substitutes, etc. Same for emergency services. If we learned anything through COVID, was that telehealth is an amazing tool to use before, during, and after a pandemic. It truly helps us reduce exposure and expands access to various specialty care services that we didn't have. During the pandemic, we used telehealth for teletriage, for tele-emergency care, for virtual rounds, for e-consults, and a lot of follow-up care could be done via telehealth. Also, behavioral health. We know there's a shortage of providers. And just imagine how leveraging technology will truly help you increase access, but also with limited services, the demand to be able to see more patients. We leverage telehealth technology for behavioral health services, for therapy, for individual therapy and group therapy, for treatment of substance abuse disorders. Many patients do not feel comfortable sometimes going into facilities, but being able to connect with them virtually is fantastic. Also, home health. Looking at telehealth for home health services is amazing. When looking at that traditional and palliative care, chronic disease management, behavioral health, and others, a home health model, including some telehealth services, is a great addition. Not only can you use it for just check-ins, but patient education, connecting not only the patients back to their caregivers and allowing for more caregiver involvement is an amazing way to leverage digital technology, medical response, and even virtual monitoring. I will show you an example of a home health service telehealth consult. So as you can see here, when we're looking at just telehealth, it does offer you that glimpse into social determinants of health that clinicians need to be able to support patients' overall physical, emotional, spiritual, and environmental well-being. But when you're looking at telehealth for like a touch point perspective, it really helps patients identify their needs and really help with interventions as needed and adherence to healthcare plan. So look at the slide that I'm showing you right now. When you're looking at remote patient monitoring, just think about if the watch kind of flares up, or if your patient isn't or a family member isn't a caregiver home. The blood pressure machine goes off, it starts beeping. All of a sudden, a nurse is running down the hall. How great would it be if a virtual nurse could connect right then and there, right by the bedside, identify the medication complex if that is one, make any adjustments as needed. Then that nurse can go back in, reschedule the in-home to stabilize that patient's condition with the nurse on site. And then we can avoid any ER divergence or any transport as necessary. The bottom one is a perfect example of just a typical way telehealth could also be used. So let's just identify a UTI infection assessment made during a virtual visit. That primary care provider could submit the lab orders after receiving that assessment. Notification from that virtual visit. The nurse back on site could adjust the schedule to draw any labs from that patient, and that patient stays there and avoids any unnecessary healthcare facility visits. How awesome would it be if we could also put a step in between there where we call the caregiver or any other loved ones and connect them as part of the consultation? These are just a few very quick and minor examples of how telehealth can be leveraged. Again, the goal for me is really just to kind of share with you how digital technology is increasing access to care, and how if we use resources and tools that are at our fingertips and readily available to us, how we can make a difference. Technology always has its challenges. And while I always say I love being a telehealth champion, we know there are so many challenges when leveraging technology. We see it every day. Perfect example, even with our cell phones. When there's no power, there's no way to charge a device. When there's no signal, you can't communicate. We most recently had an AT&T outage across the state of Georgia, and many people were affected by that. Can't even drive up the road without a phone, without a GPS, everything tethered to the phone. So we do understand that there are challenges. When looking at telehealth, what are some of those challenges that I think people need to be mindful for? It's still just the general ones, acceptance and buy-in. How many of you today were kind of hesitant about even considering telehealth? You may leave this call still unsure of whether or not you're going to leverage telehealth. So really the buy-in is still something we're working to build upon. Another major one for us and challenge in the telehealth world is broadband and connectivity. While we have come so far with increasing access to broadband, there are still many deserts and remote areas without strong enough internet to hold a telehealth consultation. It is important to know that a telehealth consultation, it's not just good enough being on a video call or an audio call. It should be equal to or better than an in-person visit. And that is very important. If your telehealth connectivity is weak and you barely have a bar and you're talking to someone who's completely glitching, that is not a true telehealth consultation. Imagine if you're trying to use a stethoscope and listen to someone's heart and lungs and you have one bar and it is glitching. How can you truly hear those lung sounds and detect heart murmurs if necessary? You cannot. That is a situation where telehealth is not accessible and not a good standard model of care for you. Credentialing and licensing. We've come a long way with telehealth licensure. There's multi-state licenses. You can cross-state licenses. You can leverage telehealth in multiple places. But it's still not exactly where we want it to be because every state is very unique. Also, reimbursement. We have come so far. 15 years ago, you couldn't have asked me to promote telehealth. The struggle was always, I'm not getting paid enough. It's too much work. It's a huge investment up front back then. And I still can't bill for it accordingly. Given the pandemic, we were able to truly justify the return on investment and show those business case scenarios for telehealth technology, which many states have come to implement. I know in the state of Georgia, when leveraging telehealth, providers can bill and they are reimbursed at the same rate as an in-person, which is very important. Couple considerations you really need to think about when leveraging telehealth technology, however, is to always make sure, if this is something you want to do, have a backup plan and just have a plan altogether. Another thing is to truly look into your state rules and regulations and know that there is a lot of resource and a lot of contacts that can help you navigate this area at no cost to you. As we mentioned, telehealth resource centers are your best friends. We are here to connect with you and help and walk you through a lot of the process. Also, really know what services are covered, what's allowed, what's not allowed, what are best practices, what are standard models of care that you need to consider, what kind of tools do you need to provide the service that you're looking at. We are here to help you. And most importantly, we know that choosing a vendor or a platform can be extremely overwhelming, especially nowadays when there are so many solutions, so many options, and so many peripherals. Look at all of your options. It doesn't have to be the latest and greatest. It doesn't have to be the most expensive solution. There are very economical web-based solutions that are HIPAA compliant and telehealth accessible for you. Again, as a reminder, telehealth or telemedicine is no longer really considered an innovation, but rather that true new mode of care delivery that has the potential to support access to high quality medical care across the board. I truly hope that today I provided you all with just a brief overview of the field of telehealth and encouraged you as future decision makers and transformational leaders, of course, to consider leveraging digital technology and digital tools to help support your patients, your families, and your loved ones. If you have any questions, please know that you can always reach out to me. I'm always here to give presentations, to give updates, to help you navigate the telehealth arena, and feel free to use us. Thank you so much for your time. I truly hope you enjoy the rest of this conference.